I'm with Amy George, who is taking care of Billy Graham's heart problems here at the North Phoenix Heart Center. And Billy went through a little bit of a health scare a couple months ago, and he's now on heart medication. Can you explain exactly what was wrong with his heart?
Sure. I have permission to share Billy's health information. He did have double pneumonia, and while he was in the hospital, he developed a little bit of heart failure. It's not uncommon. The heart and lungs are pretty closely related, but I do see him for atrial fibrillation. It's a electrical problem where the top of the heart fibrillates, so we have him on rate control medication so the bottom of the heart doesn't go too fast.
And how is his blood pressure today?
His blood pressure is a little bit elevated, so we've started him on blood pressure medication. He's tolerating it, and we're going to up-titrate it until we get his blood pressure at goal.
So right now he's just going to remain on heart medication probably for the remainder of his life to keep this situation under control?
Yes, the atrial fibrillation doesn't go away, so he'll be on heart medications for the rest of his life.
So if he didn't have access to these medications or the medications didn't exist, he probably would not be able to continue living. So it's a good thing that science is making all of these advances.
It's a good thing. If he wasn't on rate control medications, he would likely develop tachycardia-induced cardiomyopathy. The heart muscle would weaken from going too fast over time.
And how is he as a patient? Is he a good patient as far as following your instructions?
He's a great patient. He comes to all of his appointments. He takes his medications as prescribed. He calls if he has any problems. He's a perfect patient.
So I'm very fortunate to have her following me, and so I'll be her patient as long as I'm around. I'll be here visiting Amy probably once a month, I think, and I'm very fortunate to have her on my team, and along with my liver problems and now some heart issues, but she has everything under control, and I feel very confident with her, and I'm very, very thrilled to have her as my physician, my doctor, watching out for me.
He had double pneumonia, which was basically an infection in both lungs.
Yes.
With people with a lowered immune system like he has, is it fortunate that he had such good medical care to be able to survive that? Because I understand that it wasn't looking very good at some points of that.
Yes, he got good antibiotics and luckily responded. They talked about maybe going down in sampling, but they didn't have to. He responded to antibiotics and did quite well, so he's very fortunate.
Well, good. Thank you again for taking the time to fill us in on this, and hopefully Mr. Graham continues to do well.